Hi, I'm Allison Kraft.
And I'm Marique Walsh.
And we are World Communities Namibia. World Communities is a nonprofit organization I started several years ago with my father, based out of Washington, D.C. We take medical supplies that would otherwise be thrown out and ship them to needy communities all over the world. Currently, we're hoping to branch out into Namibia.
About 2 years ago, I began working with the San community of Okongo, Namibia. I painted classrooms and I built houses alongside the San. It inspired me to do more. The San are a marginalized and indigenous group of people, and there are very few aid organizations specifically targeted towards them. The programs that we want to put in place are specifically targeted at problems that the San face. And through our grassroots connections with Acacia, we know exactly what needs to be done.
In order to lift the San out of poverty, we are taking a multifaceted approach targeting health, education, and community engagement. We are starting with the town of Okongo and using this as a base of operations to spread out into outlying communities.
Currently, most of the San children are surviving off of one meal a day, comprised of the staple crop of Namibia mahangu, and we want to implement a nutrition and hygiene program in the schools to address this. And one of those programs is our Food for Thought program, which will be enacted in 3 different schools.
The other half of our program is hygiene-based. We will be sending small hygiene packages ranging with everything from soap to toothbrushes. All of our programs will be diagram-based to bridge the language gap. One of our long-term goals and an ability to monitor and track our progress will be creating health records for each child, documenting their weight, caloric intake, and their progress in school.
We are going to build up the health network of the San by starting a monthly nurse program, and this will provide the San community with monthly visits from a nurse provided by the Okongo Hospital, who will tend to the various needs of the community, ranging from monitoring pregnancies to giving immunizations, and she's also going to be training a member of the San community.
The San are a marginalized group, and we do realize the hospital may not be willing to work with us despite money. So to address that issue, we are offering the hospital an exchange program with Uganda Cancer Institute. The long-term sustainable end of our program consists of the community garden. We hope one day that these community gardens based at the 3 schools will eventually take over as the main nutritional base for the community.
One of the largest barriers faced by aid organizations working with the San has been alcohol, and our program is different in that it targets this directly with non-alcohol-based social functions, engaging parents and students with school plays, dance teams, and soccer games.
This health initiative targeting the San by World Communities with the aid of the Dell Social Innovations Grant will immediately lift the San out of debilitating poverty and set them on a path to long-term community health and production and provide the base for our long-term sustainable projects.